Madhyana. Without further delay, I'd like to call upon Dr. Muridhar Sharma sir, STMCA would be to take over the session. Welcome to you, sir.
The next chapter is about chayavipratipatti adhyayam vyakhyasyaamah ithuvata bhagavandanandarihi. The word chaya is defined as a asana lakshade chaya prabhaturatya lakshade varna matramati chaya prabha varna prakasham. Now this is a very complex issue. The chaya is something which cannot easily translated in other languages. This is something a subjective feeling when you look at a person. It's not the color. Now, this is, and I don't know whether there is a equivalent word in English or not, but mostly it's a hue. Now, instead of saying color, we may say that it's a hue, a appearance which is seen in a person as you see that. And this is a sign of the disease. Maybe even it can be used for the prognosis. The differences in the color, the chaya or varna, prabha and the chaya, these are very clearly described. Chaturvidho varna, colors are gauraha, krishna, shamaha, gaurashama iti. Color of the body could be either fair complexion, gauraha, krishna, fair, black, shamaha, somewhere in between, and gaurashama, again the combination of that. Prabha saptavidha. Prabha is again an appearance which we say as something like a look, and this is Rakta, Pita, Sita, Shava, Harita, Pandura, Sita, Iti, 7. There are, it's something which gives a color idea of the color. Chaya, the chaya is what I say as a hue, and these are categorized as Snigdha, Vimala, Ruksha, Malina, Sanshipta, Iti. So it's not simply a color, it's what we call as the appearance or a hue. Now, as far as the prognosis of the disease and prediction of the prognosis is concerned, Sushila gives a few of these descriptions as well as some of the clinical signs which we can make out by looking at a specific surface of the body. So it's actually not only the hue, will come across the signs of the systemic disorders as you look at the surface of the body or as you look at the personality of the patient. So that's how it has to be understood. Shava lohitika nila pijika vapimanam abhidravantiyam chayah saparasuha samchayam. When there is a nila, bluish colored chaya, which is often seen in cyanosis, what you see is the cyanosic condition. When it is a lohitika, reddish color, reddish hue seen, which is often seen in either niacin toxicity or hyperthyroidism conditions. And Pitika is yellow, of course, yellowish, often seen in hepatic pathologies, jaundice-like conditions. So these are all suggestive of a systemic disorder. Now, whenever Sushruta says parasuhu or a fatal sign, we will have to translate this as a sign of underlying systemic serious disorder which has to be taken in, not necessarily essentially fatal. That's one. Now, when you write the case sheet, usually you always write that a patient is either ill looking, healthy looking, and so on. So, what is that ill look? Sushruta says the description of that what we consider as ill look is Hrihi apakramate yasya prabha smriti dhriti shreyah akasmadyam bhajante va sagatasu asamshayam. A person who doesn't keep his body clean and he doesn't really doesn't follow the social regulations, the normal social regulations of behavior, that's a Hrihi apakramati. Hrihi is not simply lajja. Of course, it's translated as lajja or shyness, but it's not only shyness. Hri is a proper social behavior. If the proper social behavior is not followed, and at the same time, you always have a visible appearance of a ill look, prabha, and there is an impairment of the memory and decision capacity. These are considered as the ill look. Now, the real problem when you write the case sheet is when to consider as a ill look or when to consider as a healthy look. Now, lots of attempts are being done to make out this, and in the present, with the recent developments are making use of the artificial intelligence and the digital technology to identify which of these are considered as ill look. And one of the promising tool which has been developed is what we call as Gestalt tool, and article about that which is considered. Of course, these are not yet in regular practical use, but maybe in the future you may come across these kinds of the technological tools which are just green areas now, budding areas of development, and in due course of time it may be possible that by looking at the photograph of a person you may be able to make a diagnosis. Now this technology, lots of rather new articles or recently new developments have occurred, and if at all those are who are interested in reading about this, for the present, it's only about the reading about the information. We may not get the resources immediately, but in future we may get the resources. So those who get are interested, you may read these articles. I have just referred to some of those interesting reference articles which show some promising and maybe rather solid based information about this possible facial diagnosis as a tool. Now, going ahead, the other clinical signs of the diseases are यस्य अधरोष्ठपतितः क्षिप्रश्च ऊर्ध्वं तथा उत्तरः उभौ वा जाम्बो वा भासो दुर्लभं तस्य जीवितम्. Now, a condition where the patient would have the lips where the lower lip is retracted and the upper lip also is retracted, and the look like bulge or jambava bhasa. Now this is very typical of cerebral palsy. This kind of an appearance is very typical of the cerebral palsy, and particularly in children. In pediatric conditions of cerebral palsy, one of the important signs, of course, there are other signs of the palsy as well. One of the important clinical signs by which you can make out the cerebral palsy, as you look at the patient's face, you can make out this the signs of the lip retraction, lips under being the spasm, and hence it looks like bulging, and that's exactly what Sushruta has described as such. Now, whether to consider this as a real fatal sign or not is not the issue. So every time when we come across that word fatal sign, we will not consider it exactly in the same word meaning. Maybe you will have to think of a deep existing pathology. Now, the other clinical signs which Sushra mentions are Araktaha Dashanayasya Shavaha Syuh Patantiva Khanjana Pratima Vapi Tam Gatayasham Adisheta. Now, other than that of the local diseases of the teeth or the gum, now you rule out that. When we are talking about these signs, I always keep it as a this standard issue. We will not consider the local diseases. We will consider only the systemic diseases seen in the local area. When you look at the gums, and identification of the diseases based upon the evidence which you see in the gums also is a practical issue, and there are plenty of conditions. I have given just two examples. It's not necessary that only these two are issues. You can see plenty of such examples where the visible abnormalities of the gum can lead to a identification of underlying systemic disorder. Now, the examples which I have shown you are gums in case of leukemia, where you will have a partial hypertrophic bulging as well as a collection in the submucous area, bleeding. Aplastic anemia, where the gums tend to become atrophied, and then there is even a slight accumulation of blackish substances over the area, which is characteristic of the aplastic anemia conditions. Now, the next is about the tongue. Krishna stabdha avaliptava jihva shuna cha yasya vai karkashava bhavedyasya so atira jihatyasun. The tongue signs, evidence of the tongue, diseases in the tongue. Again, in the contemporary science, a few diseases are diagnosed, like anemia, where the tongue would be bald, or the geographic tongue, as in case of the typhoid and so on, cracked tongue, which may be suggestive of the gastrointestinal tract pathology. But in case of in Chinese medicine, this has become a very standard established method of diagnosis. And in Chinese medicine, there is a pattern of looking at the tongue and identifying the diseases at the areas, like tongue surface is again divided into the lung and heart in the tip, and maybe the liver and the gallbladder on the left side, sides as such, and in the center it's the spleen and the stomach, kidney in the posterior area. So this way there is a pattern as such, and the again the technology of identifying these abnormalities of the tongue related to the concepts of Chinese medicine, the deficiencies, what see in Ayurvedic medicine we have worked with the kapha, but in the Chinese medicine you have young Chu and so on. Now that is seen, and even digital technologies to make out this are developed, and it's a very well developed, very advanced, or very developed technique of diagnosis in Chinese medicine. Of course, whether we can use it or not, the other way. But in my clinical practice, I always try to look at this, looking at the tongue of every patient. I may not be able to make out exactly, but what I feel is there is something, some solid base for this kind of a hypothesis. Now, the next is about the signs which you can see in the nose. Kutila, sputita vapi, shushka va, esinasika, avas pujati magna va, nasajivati manavaha. Abnormalities of the nose and appearance of the nose, when the nose seems to be suppressed or deviated, or the shape is altered, or when it looks like dry and or cracked, like appearance is cracked, that's typical of certain of the diseases. And it could be sign of fatal sign according to Sushrita. Now, if we can, again, you can have plenty of conditions. Now, remember that whenever I have quoted a few examples, it doesn't mean that this list of examples is complete. There is always something more. I have just quoted a few of the examples which are quite important clinical. And the typical diagnosis of a disease by looking at the shape of the face, where in a case of leprosy, you will have that depressed nose bridge and a widened face, which we also call as Leonine facies, or in case of thalassemia, where the nose becomes widened and depressed and forehead becomes widened. That's a typical appearance of a thalassemia patient. In SLE-like conditions, collagen tissue disorder conditions, you may see the cracks over the surface of the nose, and the skin over the nose may become inelastic and rigid. So cutula, sputita, the sputita is the one. Cutula is, as you see in case of the leprosy or other way. So that's the typical features of the nose signs. Now, evidence of the nose appearance as suggestive of diseases. Then the eye signs. The next is about the eye signs. संक्षिप्ते विषमे स्तब्धे रक्ते स्वस्थ्यवचलोचने स्यातां वा प्रसूते यस्य स गतायुः नरो ध्रुवम्. When the eyes are partially constricted and the size is the visibility of the eyes is not equal, unequal opening of the eyelids, which is very typical of myasthenia gravis, where the eyelids droop down and maybe on one side or both the sides. That's the typical. Or recte, when there is a hyperemia, again it could be plenty of diseases which could be suggested by a generalized hyperemia. Vascular increase is in case of the systemic disorders like rheumatoid pathology or any other collagen tissue disorder can present as infiltration in the eyes. Now, when I say I am just ruling out all the local pathologies of the eyes, I am just including the local pathologies of the eyes. I am just suggesting about the systemic disorders which could be reflected by looking at the eyes. And recte, when there is a reddish color, as in case of rheumatoid pathology, or swaste, when the surface of the skin seems to be this rough and the total appearance looks like very tired look. Typically in atopic pathologies, atopic dermatitis conditions, where the skin becomes rough. Of course, it's not limited to only the eyelids, it could be anywhere, but commonly when a patient of atopic dermatitis, we focus more on the eyelids than elsewhere. It doesn't mean that its lesions are seen only in the eyes, it could be presented elsewhere too. And prasute, when there is a discharge, pus formation or discharges, plenty of discharges and eruptions over the area, typically as in case of leprosy, this is one of the signs. Or the abnormalities of the eye, other abnormalities of the eye, which are quite important from the clinical point of view, are in the Wilson's disease, you see that keyshare flexure ring-like appearance, hyperthyroidism presenting with the exophthalmos, or osteogenesis imperfecta present with the blue sclera. These are the typical clinical signs of underlying diseases. So whenever you look at these visible abnormalities, you have to think of the systemic disorders which may predict the prognosis later. And again, the list is not complete. You'll have to go more into that. You'll have plenty of examples can be given. I just given a few popular examples. The next is about the hair signs of the hair. केशाः सीमन्तिनो यस्य संक्षिप्ते विनतेभ्यो लुण्डन्ति च अक्षिपश्मानि so अचिराद्याति मृत्युवे. The abnormalities of the hairs and eyebrows. If the eyebrows and hairs they become brittle or they are scarred or alopecia like conditions, they are suggestive of the systemic disorders. Now, a typical malnourishment would show the hairs becoming thin and fragile, tend to be broken down, and the number of hairs in an area also can be slightly reduced. Often there is a slight baldness. It's not a total baldness, slight baldness extending from the frontal area towards the posterior area. Hypothyroidism is typically presented with the hair loss, patchy hair losses. Some areas where again it's not a alopecia, areata-like conditions, there will be no cicatrization. It's a non-cicatrizing hair loss. Whereas a cicatrizing hair loss, that's if there is area of the hair loss, if the skin is altered and has become cicatrized, that's a typical of a lupus pathology. In Cushing syndrome, again, the hairs become less dense and the hairs become thick, somewhat thick and brittle. A malnourishment, thin and brittle. A Cushing syndrome, thick and brittle. These are the typical hair signs which you could see. And of course, you'll have plenty of other diseases also, which can be considered as the clinical signs. Now, the next is about the level of consciousness of the patient to be assessed. Naharati annam asyastam nadharayati shiraha ekagradrustihi mudhatma satya pranandhati saha. Assessment of the reflexes of the patient to grade the consciousness is one of the issue. When a patient doesn't swallow the food which is given in Naharati Annam Asyastam and keeps the food in the mouth, that means his response to the stimuli are lesser. Ekagra Drishti, his eyes also, eyeball movements also are not really proper, and Mudhatma, his other verbal response is poor. Now, when we say a Glasgow Coma scale, which is a very popular scale used for assessing the patient's unconsciousness, grading the level of unconsciousness, it's exactly the same. You look at the eye-opening responses, ekagradrishti, and the verbal responses, mudhatma as such, and the motor response very specifically assessed in Sushruta by the Raharati Annamas system, the food swallowed, the swallowing reflexes being assessed. Of course, now we have bit more delayed, more standardized protocol of examining and a scoring system, which makes it more objective. Whereas what Sushra has mentioned is just a maybe concise and precise method of assessing the level of consciousness. Then the next is Balavan Durbalo Vapi, Samoham Yo Rigachari, Utthapyamano Bahushaha, Tam Papam Vishagadisheta. A person who tends to lose his consciousness or the consciousness becomes impaired on making him erect from the lying down posture. When the postural changes produce the impairment of the consciousness, that's exactly the postural hypotension, and that postural hypotension is again a sign of many of the diseases. Very important is a patient who has a non-compliance of the circulatory system. The volume of the circulatory fluid is lesser, as in case of the dehydration or in a patient of shock, in grades of shock, it could be said. In addition to that shock and dehydration, other conditions which can produce the postural hypotension are certain medicines like antihypertensive drugs or vasodilator drugs, or it could be the chronic diseases like patients of autonomic insufficiencies, diabetes, Parkinson's, or patients on hypertension treatment or chronic renal failure as. Or there is another very specific condition like postprandial. That's a hypotension, postural hypotension occurring after consumption of the food, which is quite characteristic in the clinical situation. Patients who feel giddiness after the consumption of the food, you need to think of the diseases like autonomic deficiencies, diabetes mellitus, hypertension, etc. They have to be considered, and from the clinical point of view, this is one of the important clinical signs as such. Then another is the diagnosis of postural diagnosis. Postural diagnosis are ubiquitous diagnosis, like the position of the patient. उत्तरः सर्वदा श्रूयते पादौ विकृतेजयः viprasaranashilo va na sa jivati manava. A person who is lying down with either the legs constricted or inward flexed or outward flexed, keeping the legs rigid, and that rigidity is a very characteristic feature. And in that rigidity condition, patient may present with the foot inward located, as you see in the inward, internally inward, or the foot which is outward, legs are straight and kept outward. These are typical clinical signs of either decorticate or decerebrate rigidity. A patient who is brought in unconscious position, you have to evaluate these conditions, particularly patients with the possible neurological deficits, cerebrovascular accidents, head injury, and so on. In such conditions, this is a very important clinical sign of making out this whether the patient is a decorticate or decerebrate. A decerebrate patient would always have more serious issues. When we say decerebrate, it means there is a abnormality or injury at the base of the brain, and hence vital centers may be disconnected. Whereas decorticate is where the cortical area is affected, and patients with the cerebrovascular accidents like hemorrhage, etc., they often come with the decorticate posture. The position of the patient will be like the hands will be flexed and the body would be rigid, legs are usually internally rotated. This is the usual position. Whereas a decerebrate, where the patient would have a pathology of the cerebrate, the hands would be straight and extended, and legs also would be straight, and toes would be pointed downwards. That's because of the stretch asset. This is about the clinical signs of position, and that's what Sushruta says, Uttana Savadashite, Padavu Vikuluteja, Viprasarnashila. Then the abnormalities of the breathing. Shitapada Karotchasa, Chinna Uchasastyo Bhavet, Kakochasastyo Martya, Tam Dhira Parivardeyat. The patients who present with the cold and clammy limbs, again signs of shock, and patient may have two sorts of the abnormalities according to Sushruta, either Chinna Uchvasa or Kakochvasa. Chinna Uchvasa is when there is a pause in the breathing, and that pause in the breathing is characteristically, now we name them as a chain Stokes breathing or Biot's breathing, which is also called as synesis. The differences are, in case of chain Stokes breathing, the volume of the breathing gradually ascends up and then descends down. There is a pause. Again, this cycle goes on. Whereas in the pause breathing, you will have a few of the breathings which are deep and then a gap, which both of them are suggestive of a respiratory center failure, or kakochvasa. Kakochvasa is rapid breathing, which could be either Kussmaul's breathing, where the deep breathing is deeper, again characteristic of the acidosis, or superficial breathing is where the total volume is lesser, where you may suspect about the failure, peripheral structures, failure of the muscles and the neurological control of respiration. So these are established clinical signs which are used in assessing the patient's status, predicting the prognosis, and that's what exactly is mentioned by Sushruta as Chinna Uchvasa and Kakochvasa. Chinna Uchvasa is the chain Stokes feature, and Kakochvasa is a feature of Kussmaul or superficial breathing. निद्राण छिद्यतेयस्य यो वा जागर्ति सर्वदा मुह्येद्वा वक्तुकामश्च प्रत्याख्येयः स जानता. A person who we cannot awaken from the sleep, who has a sleep which cannot be awakened, deep sleep, rather a deeper level of unconsciousness again, or a person who is not able to sleep at all, who keeps awake throughout, or a person who gets confused when he starts speaking, he is not having a relevant speech, they again suggest some poor prognosis. That's quite obvious. Like whenever we see a person with these kinds of behaviors, we consider that patient has a impairment of the consciousness, and then we usually adopt the Glasgow Coma scale to make out. So that's exactly the issue. उत्तरोत्तम दृश्येत उत्कारं च करोत्यः प्रेतिर्वा भाषते सार्धं प्रेतरूपं तमार्षेत. A person who licks his upper lip repeatedly due to the dryness of the mouth, or a person who produces some sounds, snoring sounds, like the sounds which is again suggestive of a respiratory obstruction, partial respiratory obstruction, or averted breathing, or Preteva Bhashade, who speaks about speaks with the persons who are dead, or celestial bodies, who speaks in the celestial bodies. So that's again irrelevant speech. These are considered as signs of fatal complications. Then another of the fatal signs are खेभ्यः सरोमकूपेभ्यः यस्य रक्तं प्रवर्तते पुरुषस्य विषाक्तस्य सद्यो दुह्यात् जीवितम्. A person particularly who has consumed poison, if at all you can see a subcutaneous hemorrhagic spots, bleeding in the subcutaneous area, reddish spots over there, then that has to be considered as a fatal sign according to Sushruta. Now, from the clinical point of view, the important, very important conditions where you may have this subcutaneous hemorrhage could be the spider anemia, which is usually a sign of hepatic pathology as such, where you will have a hemorrhagic spot, and then the network of the capillary seen around looks like the legs of a spider, or in the conditions of clotting disorder, hemophilia and so on, the plenty of other conditions, or patients who are on anticoagulant drugs, there could be bleeding, patchy bleeding, particularly over the area where the body pressure is more, and a widespread patchy bleeding could be seen. A connective tissue disorders also can present with subcutaneous hemorrhages, but in that condition, the bleeding spot would be at that area where the skin is stretched, moved, like over the joints, axilla, neck, etc. These are the areas where they could be seen, which could be suggestive of a connective tissue disorder. A patient presenting with the hemorrhagic spots over there, you'll have to make out. In a case of purpura, the spots of bleeding could be anywhere. That's how it could be seen as such. Then the other clinical signs are वाताश्चीलात् हृदये यस्य ऊर्ध्वम् अनुयायिनी रुजा अन्नद्विद्वेषकरी सपरासुः असंशयम्. A person with bloating abdomen, abdominal disorder, and the same would be presenting with pain in the chest, and it even results in ruja, severe pain, annavidveshakari. He is not able to consume the food at all. That's a fatal sign. This is very typical of the angina pathologies or coronary pathologies. Patients with the cardiac pathologies, pain produced in cardiac disorders, can often mimic the gastrointestinal tract pathology. The patient may feel the distension in the abdomen, and then the pain could be felt in the chest, and that could be confusing as such. Then ananya upadravakritah shobha padasmuchitah purusham hanti narim च मुखजो गुह्यजोद्भयम्. Edema occurring in a patient without other specific Shofa Vyadi disease conditions, and that could be a sign of poor prognosis. Now, Sushruta gives a very specific issue. If the Shofa starts in males in legs, a dependent edema in males, or edema in the face in females, they are signs of poor prognosis. Of course, whether this is really true or not, questionable. But in a patient who has a dependent edema in the legs, dependent portions like the legs, it suggests you of usually suggests of a cardiac failure, a improper pumping of the blood. It also could be produced due to increased volume of the circulation. And mukhajaha, when the edema is seen more prominently in the face than elsewhere, it could be often sign of the osmotic pressure abnormalities. Abnormalities of the osmotic pressure like hypoproteinemia, produced with renal pathologies and so on. A hydrostatic pressure abnormality often results in the pedal edema, whereas the edema throughout, which is more prominently seen in the face, is usually produced due to osmotic pressure abnormality, and the causes could be plenty of those. Now, whether this prognosis is related to the gender of the person, like male or the female, this is questionable. But Sushruta has mentioned this, so we will not go into further discussion like whether Sushruta was right or wrong. But as per the current knowledge, we do not have such a relationship established. Then अतिसारः ज्वरो हिक्का छर्दिः शूलाण्डमेधृता श्वासिनः कासिनो अपि यस्य तं क्षीणमादिशेत्. Patient with gastrointestinal tract abnormality, fever or hiccup or vomiting, if he develops edema in the genital area, again the edema in the genital area is again often a sign of abnormalities of the mesenteric circulation, intra-abdominal pressure conditions. If it is increased due to either a mass in the abdomen or ascites, patients developing ascites, the often the edema is seen in the genital area, in the penis and the scrotal area, and this is a poor sign. So it's actually a reflection of the intra-abdominal accumulation of the fluid. And whenever the patient has a gastrointestinal tract abnormality and at the same time there is a ascites fluid, you'll always think of some serious issue. The further attempts to make the diagnosis are necessary. and and most of the times the condition is irreversible. Then Svedo Dahashta Balavan Hika Swasaschamanam Balavantam Pradin Vinjanti Nasamshaya. When a severe burning sensation along with the hiccup and breathlessness, that can also be fatal sign, which is very common in case of cardiac pathologies. Sweating with a abnormality of breathing, which is often coexisting in case of acute cardiac pathology, like ventricular failure like conditions or myocardial infarction like conditions. शावा जिह्वा भवेद्यस्य सव्यं च अक्षिनिमज्जति मुखं च जायते पूति यस्य तं परिवर्धयेत्. A sudden bluish development color of the tongue, again cyanosis, and savyam च अक्षिनिमज्जति, the eyes tend to become just drooping down, closed down, and the patient's breathing will become foul smelling. The breathed out air becomes foul. These are signs of the fatal signs. Of course, it's all the signs of cyanosis or acidosis developing. So it's a acute condition. There is a need to evaluate. Causes could be plenty. It's not that we can just point out a single cause for that, but there is a need for a proper evaluation, and it's an acute emergency. वक्त्रम् आपूर्यते अश्रूणां स्विद्यते चरणौ उभौ चक्षुश्च आकुलतां याति यमराष्ट्रं गमिष्यतः. If the person is not able to swallow the saliva and the saliva is accumulated in the mouth, or similarly the tears also are collected in the eyes, just accumulation of that fluid, and it has more sweating in the limbs, periphery, our eyes also become just turbid, like there is a conjunctival infiltration. These are all signs of fatal complications. Of course, a swallowing reflex being absent is again a cause sign of cause concern, where I don't pinpoint a single cause, but a patient who presents with the abnormality of swallowing reflexes, you need an extra care. You have to ensure that the saliva is extracted out by suction, or ensure the clearness of the respiratory passages, otherwise it can become fatal. So these are all the signs which suggest about a poor prognosis or which require an immediate attention as such. अतिमात्रं लघूनि स्युः गात्राणि गुरुकाणि वा यस्य अकस्मात् सविज्ञेयः गन्ता दैवसुतालयं वैवस्वतालयं. Now, if say sudden weight loss or a sudden weight gain or atrophy of a specific organ or hypertrophy of a specific organ all of a sudden occurs, that's a sign of a poor prognosis. That's quite true. Like in any of such conditions, you need to think of some issues which are quite severe. Panka Matsya Vasa Taila Ghata Gandhamshe Yonaraha Mrista Gandhamshe Yovanti Grantarahati MRM. If there is some abnormalities of the smell over the body, like a smell of dirt or smell of oil or vasa, etc., are seen, the abnormalities of the smell of the body is also a sign of the disease. Of course, later in the next coming issues, we will have more discussion about these smells of the body, which could be suggestive of the diseases. In the next chapter, you will have more of Gandha Vikriti. There we will discuss about that. युकाः ललाटमायान्ति बलिं नष्टन्ति वायसाः येषां चापि रतिर्नास्ति याथारस्ते यमालयम्. Insects creeping over the forehead of a person, or birds don't consume the food given by a person. These are signs of and a person who tends to have restless, who doesn't have a pleasant status of mind. These are all considered as a signs, fatal signs. Of course, as far as the Balim National Vayasaha, again questionable, like how the things are related. If a person gives food to birds, particularly crows, and if the crows do not take the food, that's a sign, fatal sign, according to Sushruta. Of course, in our folk practice also, this is believed very strongly, but objectively we do not have any definite data about this. But these are all certain of the controversial issues. Whether these are true or not, we will not go into that. Then Jaratisara Shopahasu Anyonya Avasadina Prakshina Balavansasya Nasau Shakyachikistam. A person who has a fever, then diarrhea, and then edema over the body. In these occur one after the other, and which can even produce intermittent these intermingling complications, one after the other, or occurring somewhere initially fever and then the edema and so on, which are again signs of a serious issue and often could be leading to toxemia. And if the patient also has Prakshinabala Mansar, the total vitality of the patient is reduced, that considered as incurable according to Susta. Now, of course, we may not consider as incurable, but it's a condition which requires an acute attention. क्षीणस्य यस्य क्षुत्रस्ने हृद्यैः मिष्टैः हितैस्तदा न शाम्यते अन्नपानैश्च तस्य मृत्युः उपस्थितः. A person who is emaciated, but his appetite, hunger or the thirst cannot be treated with a good quality of food or with sufficient water, then if there is a persisting thirst or the hunger, that also could be a sign of poor prognosis. That's again a sign of incoherence as such. Patient's inability to have a proper homeostatic mechanism could be seen as this uncontrolled food consumption or uncontrolled fluid consumption, etc. But of course, it's also a poor sign, but may not be very evident in the regular clinical practice. प्रवाहिका शिरशूलं कोष्ठशूलं च दारुणं पिपासा बलहानिश्च तस्य मृत्युः उपस्थितः. A patient having severe diarrhea, if he develops a severe headache and koष्ठशूला, pain in the abdomen, and excess of thirst and reduced vitality, that could be a sign of fatal complications. So that's a sign of dehydration. Typically, a patient with dehydration due to the fluid loss from the gastrointestinal tract would have these signs as such. विषमेण उपचारेण कर्मभिश्च पुराकृतिः अनित्यत्वात् जन्तूनां जीवितं निधनं व्रजेत. A person who doesn't have these signs also may develop these complications if the treatment protocol is not proper. If somebody starts with the wrong protocol of the treatment, or due to a previous janma, the these sins of the previous janma, there could be sudden death without evidently seen signs of the arista lakshanas, but they would be there. That's what Sushruta says as pretaha bhutaha pishachascha rakshamsi vividhani va marnabhimukam nityam upasatpanti manavam tani bheshaji viryani pratignanti jighamsaya tasmat mogha kriya sarvaha bhavanti eva gatavisham. A person who is nearing the death is more prone to get infected with the different organisms. Pretaha, bhutaha, pishataha, I would consider them as a microorganism. So patient is more prone to develop the infections, and hence once the patient is infected, the other medicines, your drugs and their effects may not be producing the same effect as such, and they, according to Sushruta, the microorganisms also would be affecting the function of the drug. Pharmacological effect of the drugs is affected, and hence once the patient gets that infective complications in the end stage, then there is absolutely no cure. It's considered as incurable. Now, when it comes to the question of that diagnosis by looking at the face, there is another technique which has become somewhat popular, but again not in this mainstream medicine, but elsewhere the things which are becoming popular or somewhat popular as such is identifying these organs over the face, the facial diagnosis. This facial diagnosis is different from the facial diagnosis we have mentioned in the beginning. That facial diagnosis I have mentioned in the beginning is about the photograph images and then image analysis. Now, this is a parallel issue. It's not of the mainstream medicine. Parallel issue. There is a system which says that by looking at the face, you can locate the organs and the diseases. Kidneys, liver in the face, small intestine, bladder. Again, these are all vague. I don't know whether these are really true or not. But this kind of an approach in the diagnosis also is popular in some areas. So that's just a casual reference to that. With this, we conclude. Iti Sushruta Samhita Sutrasthane chayavipratipatti nama ekatrimshodhyayah. With this, we will conclude today. If there are any questions, I will try to answer and then bind up. Right. There seems to be no questions. Right. Right. So we will bind up.